Hello everyone. Here is my third lecture related to the anatomy of the ureter and suprarenal glands. The ureter is a primary retroperitoneal organ or duct, which about 10 inches long or about 25 centimeter, and it is divided into, here is the ureter here. It is divided into abdominal part and the pelvic part. Here is the abdominal part, here is the pelvic part. So here is the abdominal part here, and here is the pelvic part. The ureter has mainly two divisions, abdominal and pelvic, but sometimes the last part is called intravesical or intramural part inside this bladder here. So that's the intramural part within the urinary bladder. The ureter is convey urine from kidney here is the kidney to the bladder. So just carrier of urine. The ureter is starting here from renal hilum, and of course here is this part, we call it renal pelvis. So what is the renal pelvis? It is upper dilated part of the ureter, which is the most dilated part of the ureter. And then it go down here until the urinary bladder here. This renal pelvis could be outside the kidney, we call it extrarenal, or could be inside the kidney, in this case it's called intrarenal. The ureter has normally sites of constrictions or narrowing, which can stimulate the formation of calculus or stone here. So sites of stone formation at these constrictions. There are three main sites. One site at the junction of pelvis with the ureter, we call it pelvic junction, this one. Another site where the ureter crosses the common iliac artery here. The third site inside the urinary bladder, we call it intramural part or within the urinary bladder, this one here, inside the urinary bladder. So this is the main sites of ureteric constriction. There are other sites in the pelvis where the ureter is crossed by vas deferens or uterine artery, but you will know it when you study the pelvis. The ureter, as you see here, is formed by, as I mentioned, this is the dilated upper part of the ureter, which is called renal pelvis, this one. So this renal pelvis divide into, as I mentioned before, major calyces, three major calyces, and then this major calyces divide into minor calyces here, minor calyces. So here is the major calyces, and here is the pelvis of the ureter, or renal pelvis, and here is the major calyces 3, and then here is minor calyces around 6. So every major divided into two minor calyces, and this is biogram or intravenous biogram, which shows the whole course of the ureter here, and here is the bladder. And you see also here the ureter is crossing the transverse processes of lumbar vertebrae. As you see here, the ureter is crossing the transverse processes of lumbar vertebrae, and then at the level of ischial spine here, it turns medially to the enter the urinary bladder. I think Also, I think you know about this before. I mentioned it when I taught you the kidney. It's called renal pyramids. So here, every minor calyx here is opposite the apex of the pyramid. We call it the papilla. Here is the papilla, or apex, and here is the minor calyx. Posterior relations and the blood supply. When you see this image, here is the ureter here. Here is the ureter, and here is another ureter. So posterior relations basically is almost like kidney. So when ureter go down, it passes deep to the ureter. Here is the psoas major muscle, and also maybe psoas minor is if it's found. And also there is one nerve on psoas major here called genitofemoral nerve. Genitofemoral nerve is this nerve, yellow color here. It is a branch from lumbar plexus L2. And also posterior to the ureter here, posterior to the ureter is this part, you can find the common iliac artery and its bifurcation into external iliac and internal iliac. So that is posterior relations of the kidney. Here is again the size of ureteric constriction. So we mentioned about it. So if you look blood supply of the ureter, as you see here, the ureter is related to many blood vessels here. Any artery cross the ureter gives the ureter its blood supply. So for example, if you look here, here is the renal artery here, so it can supply the ureter. Here is the gonadal artery here, or it can be testicular or ovarian, supply also the ureter because it's passing in front of it. Also, the common iliac here also can supply the ureter. So any artery passing either superficial or deep to the ureter can supply it. So here the anterior relations of the ureter. So here is the ureter, is the right ureter, here is the left ureter. Of course, right ureter here is crossed by blood vessels mainly. On right side, right colic vessels, ileocolic vessels, and right gonadal vessels. And also root of mesentery, and you can see also terminal part of the ileum. Here, terminal part of the ileum. All these are anterior to the ureter, and of course, all these blood vessels supply the ureter with blood supply. Of course, there is vessels means arteries and veins. On the left side, just you can say left colic, sigmoid vessels, and the left gonadal. Of course, left colic and sigmoid vessels from inferior mesenteric artery. Right colic here and ileocolic from superior mesenteric artery. Also, the left ureter is crossed by the pelvic mesocolon here, the apex of pelvic mesocolon, or sigmoid mesocolon. That's the anterior, and that's important because, for example, if there is a stone here, if in the upper part of the ureter, I mean here, our renal pelvis, also it is anterior to the duodenum. So if there is a stone here, for example, in this part, or a stone here, so that's a problem because it's difficult to remove the stone while the duodenum is here. So we have to reflect and remove the peritoneum from the anterior surface of the duodenum to reflect it laterally, to reflect it medially, and then access the ureter to get the stone. Also, same here also in case of pelvic mesocolon and terminal part of the ileum. If there is a stone around deep to these parts, we have to be careful not to injure them. The lymphatic and the nerve supply of the kidney and the ureter, and of course we already mentioned it before, the kidney. So here we talk about ureter mainly. So the lymph nodes of the ureter depends on the which part. So the upper part of the ureter or upper third drain to the to the lumbar lymph nodes or aortic lymph nodes here. Same like kidney. Middle part here drain to the common iliac lymph node, and the lower part here drain to the internal iliac and external iliac lymph node. The nerve supply of the ureter, it is parasympathetic from plexus, parasympathetic plexus around celiac, like superior mesenteric plexus and celiac plexus. The sympathetic is from nerve called pelvic splanchnic. The sympathetic nerve supply of the ureter is related to the pelvic splanchnic nerve. It is pelvic splanchnic nerve. So here, where it is, pelvic, parasympathetic nerve supply, sympathetic from pelvic splanchnic nerve, which from, as you see here, sympathetic fibers and, the sympathetic fibers come from celiac plexus and superior mesenteric plexus from T11 to L1. This is the sympathetic. Parasympathetic here from pelvic splanchnic nerve, S2 to S4. So remember, pelvic splanchnic nerve, it's a parasympathetic nerve of the ureter. I think that's enough for the ureter. Let's go to next. Is suprarenal gland. Suprarenal gland, or in Japanese fukujin, it's called adrenal gland. This gland is very important because it has endocrine and function. Well, it has two parts, medulla and the cortex. If you look here is the right suprarenal gland, and here is the left suprarenal gland. So when you make section here, it's formed from two parts, like the kidney. Inside is the part inside is medulla, and the part outside is cortex. And the medulla secrete adrenaline and noradrenaline, and the cortex secrete some hormones like aldosterone, corticosteroids, and so that's very important organ, and it is essential for life. So you have to study it very well. When you see the right adrenal gland and the left adrenal gland, before I talk about the difference, embryologically the cortex of the suprarenal gland developed from mesoderm, but medulla developed from ectoderm. When you look at the difference between right and the left, you can see easily the shape here is on the right side. The right adrenal gland is pyramidal, but the left is semilunar. Every gland, of course, is located at the upper end of the corresponding kidney. Every gland has rich blood supply, 3 arteries and 1 vein. So the 3 arteries supplying each gland, one is called superior suprarenal, one is called middle suprarenal, and one is called inferior suprarenal. So there are 3 suprarenal arteries. The one, this one is not the superior suprarenal. Here is the superior suprarenal arteries. This one. Here is the superior suprarenal arteries, which arise from inferior phrenic artery. Here is the inferior phrenic artery, which is branched from abdominal aorta. So this inferior phrenic artery gives rise to superior suprarenal arteries, maybe 3 or 4, many branches. And then here is the middle suprarenal artery, which is branched from abdominal aorta. And then here is the inferior suprarenal artery, which is branched from the renal artery. So every gland has 3 suprarenal arteries from different sources. Every gland has 2 veins. 1 vein. In case of the right suprarenal gland, it has a right suprarenal vein, which drain to the IVC or inferior vena cava here. And in case of the left gland, it has a left suprarenal vein which drain into the left renal vein. Drain into the left renal vein. That's important difference between left gland and right gland. If we talk about the relationships, the relations of the gland also is important to know. For example, if this is the left is the right gland, so what is anterior to the right gland here? For example, here is the, for example, liver. Also, you can anterior also to it is the this related to it is this inferior vena cava. Inferior vena cava, as you see here, and that's very important when we make operation on the right adrenal gland. For example, removal of right adrenal gland. If this is cancer here, may be difficult to remove because it's close relationship to the inferior vena cava also on the liver. In case of the left adrenal gland, of course, what's anterior to it? For example, here the stomach here, and of course also you can find the spleen. The pancreas. It's anterior to the this gland. So also this important relations. What's posterior to both adrenal gland? Of course, the diaphragm. So on the, both sides there is diaphragm which is posterior to the glands, these glands. Okay. What else about this gland? Here is another image which shows a blood supply. So here is the superior suprarenal arteries which arise from inferior phrenic artery. Here is the middle suprarenal artery or arteries because it's more than one branch. It arises from the abdominal aorta, and then the inferior suprarenal artery which arises from the renal artery. Here is the venous drainage. As you see, here is the in case of the right suprarenal vein drain directly to the inferior vena cava here, but the left suprarenal vein drain into the left renal vein. What else here? Here is the surface anatomy of the kidneys. Maybe I didn't mention about it when I discussed the anatomy of the kidney. So just to remember, to locate the kidney, we do what's called Morris parallelogram, and this we make two vertical lines. Here is the lateral border of the kidney. Here is the medial border. Of course, here is the ureter, part of the ureter here. Okay. So we make two vertical lines. One is 2.5 centimeter from here is the midline. Okay, it's thoracic, it's the lumbar. So 2.5 centimeter is the medial border, and 7 centimeter it is the from lateral border. And then we make two horizontal lines, one at the level of T12 and another at the level of LC3. So we make here horizontal lines, two, and two vertical lines. That's Morris parallelogram, and we can found inside it the kidneys. So that's important to detect the kidney on the back. And if you look here, also here is the iliac crest. So from iliac crest to the right kidney here, it's 1.5 inch, but from iliac crest to the left kidney, it's 2 inches. So we can detect the lower ends of both kidneys by just palpating highest point of the iliac crest. Clinical anatomy of the ureter's kidneys and the suprarenal gland. As I mentioned before, the ureter could be duplicated like this, double ureter, could be bifid, divided. We call it bifid. Here is bifid pelvis, means divided pelvis. Here is also, you can see the kind of bifid pelvis here. The kidney could be like this shape. We call it horseshoe kidney. Horse, because like horseshoe kidney. It is because kidney was developing in the pelvis, then go up to the abdomen. So while the kidney ascending up to the abdomen, it was pelvic during embryonic life, but go up to adult position. When it's trying to go, when the kidney is growing, trying to go up, it may face the inferior mesenteric artery. This inferior mesenteric artery can can obstruct the ascent of the kidney in case of their fusion like this. That's why horseshoe kidney stay in the pelvis. So that's the horseshoe kidney, because it is prevented from, it is pelvic, it stay in the pelvis because it cannot ascend because of obstruction by inferior mesenteric artery. Also, as I mentioned before, it is left renal vein entrapment syndrome. I think I already mentioned it when I talked about the left renal vein in the kidney lecture. As you see here, the left renal vein here could be compressed between superior mesenteric artery and abdominal aorta, and like here, and that's not Kanaker syndrome, which is important to know because it can induce damage to the kidney, and the patient suffer from renal pain and hematuria. Here is kidney transplantation, where usually we take the left kidney because it has longer left renal vein, and here is the donor kidney, left kidney. We put it here in the right iliac fossa, and we connect this kidney with here is the left renal vein of donor kidney connected to the here external iliac vein of the recipient, and also we connect the renal artery here to the external iliac artery, could be also in our internal iliac artery, and then of the recipient, and then we connect the ureter of the donor to the bladder of the recipient by making what's called ureterocystostomy. Here is one of my papers which shows that I found here that there are two. Here is the right kidney, and here is the left kidney, and here is the left renal vein here. So I found that there is another vena cava here. We call it left inferior vena cava. Here is the right inferior vena cava. It's a normal one. And here is the abdominal aorta. So the left inferior vena cava here is variation, and this variation is this vein. It terminates here in the left renal vein, and then the left renal vein terminates in the here is the right inferior vena cava, and this variation is surgically important because it has implications in hepatic surgery, and also, of course, also it has implication in renal surgery, renal transplantation, and also important for upper abdominal surgery. So that's regarding the double inferior vena cava. I think I mentioned important points related to the suprarenal gland, and also you can read this by yourself. Thank you and good luck.